anyone has a question, if you wouldn't mind raising your hand, and then we can call on you to unmute yourself and ask your question. Thank you.
Hi, Joe. Speaking from
Hi.
Barcelona. Uh,
Hi. How are you?
hey, yeah, I've been a follower of Lacan's work for some 30 years now.
Uh-huh.
He has let go of the experience of the unconscious for what he's now calling the speaking subject,
Right.
whereby the unconscious is hidden in plain sight in the very words that are spoken by the analyst. He sees each of us as a poem, and he speaks about how he even sees his own life as a poem. And I suppose the work of the analyst is to decipher that poem and not interfere with, not impose the agenda of the analyst onto the analysand to
Right.
open to open up what we're calling the structure and the underlying structure. Uh, I'm wondering how you feel about his uh, declaring that he's letting go of the whole notion of the unconscious. It's all out there in the
Well,
open and in the words.
that's perfect. I mean, I feel like that's really a perfect statement because he's kind of giving up probably what he experiences as a now very empty concept, because and I like Lacan's ideas, and like what you're saying is that he's saying it's our spoken subjectivity that's what's important. I think what he's also saying how difficult it is for a person to speak their subjectivity or their truth or whatever we want to call it. So I think I like that idea a lot because I feel like I like the idea of the unconscious, but I think it is a floating concept. It changes with culture, with time, and with theorists. So letting it go doesn't seem to me to be a shocking thing.
Well,
I kind of say
uh,
something. Um,
ultimately, yeah, ultimately, he'll say the only resistance is the resistance of the analyst,
right,
ne never the resistance of the analysand.
right,
And the unconscious is out there, hidden in plain sight in every word, or the homophony of the words, how one word opens up, echoes so many other dimensions that can be opened up in the work.
right, right. No, um, that it's kind of like really highlighting that whole idea of what we mean by the unconscious. And one of the things I like about Lacan, I'm sure you do, is he likes to be shocking. He likes to shock people. He doesn't, which is part of his way of speaking,
Mhm.
you know, and I think kind of making a statement like that is like shocking to people, and I think um I So I always appreciate that with Lacan, it's both shocking and he's making a joke at the time.
Yeah, right. And he's so dense the
Yeah,
way he puts things. But speaking of satisfaction and desire, he speaks of the capitalist discourse,
right,
this consumption that never gets satisfied, and the jouissance that people cling to and will never let go of, and how to work with that and identify it. Yeah,
a lot of the people who commented on that zombie film, World War Z, were
right.
like, and um, talked about the kind of capitalist discourse, you know.
Mhm. Well, thank you.
Thank you.
Thanks, Lawrence. I think I missed Karen Lombardi had her hand raised, and I missed that. If you can unmute yourself to ask the question, Karen, that would be great. If you still have it.
Actually, I still have the question, but I'm while you were talking, Larry, I was thinking of Mel Brooks' movie High Anxiety, which I just taught a couple of weeks ago, where the whole movie is about the unconscious hidden in plain sight. That's the theme of the movie. So I get that. Joe also knows I'm not fond of Lacan, but I'm very fond of Zizek and Kristeva, both of
Right.
whom use his ideas all of the time. So um, my question had to do, Joe, with like taking different things from different theories. What I find is important to me is that people understand when our theories are cultural political and
Right.
when and if they're universal, if they're ever universal. And I think there's something about psychoanalysis and just the conscious, unconscious parts of us that's universal. Everybody has, right? Everybody lives in that place, which is why I like Klein and I like Mate Blanco and I like Racker because they talk about uh, their structures apply to all of us, like love, hate, and the epistomophilic instinct. Or it doesn't matter what culture you live in, you have those experiences, right? And Mate Blanco, similarity and difference. It doesn't matter what culture you live in, you experience that. What bothers me, and this is why I like Zizek and Kristeva so much, because they acknowledge when they're talking about culture.
Mm-hmm.
They bend psychoanalysis to culture and cultural ideas. But like ego psychology or American relational theory, they don't acknowledge that they're culturally bound. So I just want you to respond to that. What do you think of that?
Look, firstly, I agree with what you're saying here. And yes, I think many theories do not acknowledge that they are really talking about a particular cultural time. And you know, I like the history of psychoanalysis also because it's about history and time and different places and what other events were happening during those times. But yeah, I feel like that's been a kind of a problem. And this idea that I think Larry was talking about of kind of like trying to act like we know more than we do
Mm.
is kind of a problem. And I think it is unfortunate that culture has been left out so often, you know, of that. And what Dustin was saying, you know, about kind of contemporary media and scrolling on our phones all the time, is our time. We're going to be, you know, um, what I would add, you know, this isn't a surprise to you, but it's also that part of, I think, our time has to do with the deadness and the numbing of people's lives. And that I think that's a cultural phenomenon that doesn't get recognized enough. And that how it gets supported continuously, um, which I think is a sad psychoanalytic issue because it doesn't get addressed. So,
Right. Do you think that the illusion that we have the answer always at our fingertips through our AI and just the internet and all of the knowledge that we seemingly have all the answers, do you think that is killing the curiosity, the instinct
that's a
to
I I don't know, actually. I think you are, I have to admit that I've avoided a lot of social media, much of social media. Other than my phone is the only thing that gets to me. But yeah, I think that we are living in a changing time that we are not recognizing. And I'm sure, like at the Institute, when people present cases, case conferences, there's a lot of issues of kind of like undeveloped unconscious processes that you could get so stuck in the conscious world, um, that
Right.
you kind of miss out on the kind of that other part of it.
Right. Yeah. It will be very interesting to see how our cultural context of our times now, the analysts writing now, will
Right.
reflect looking back. Elizabeth?
So we're talking about, this culture of thinking we know and of knowing. How do we nurture in our clients and ourselves in our society this idea of not knowing and being okay with not knowing? Because really all the only true thing that we know is that we're unsure, that we don't actually know, that there is no one actual objectivity to anything. So how do we nurture that idea for ourselves and for our patients in the context of the culture we're presently in?
Well, I think that I actually think it's much more important right now to kind of nurture that in ourselves and as kind of analysts, because I feel like to be able to tolerate not knowing, um, is kind of really difficult when we want to kind of know, when we want to feel, we're successful, we're good, we're efficacious. And so I think that's what I think in terms of my, being in my work, is to kind of try to help people sit with not knowing. And I think to the degree that we are able to do that, um, I think we're able to do that and convey that to kind of patients and help them become more curious. Um, I don't know, like Lacan, like a lot of very successful psychoanalytic stars, like rock and roll stars. Um, I just have, well, um, you know, said that the analyst is the one who's supposed to know. And he said that, meaning that's the way the patient perceives us, and it's not true. And to the degree that we allow ourselves to be the person who's supposed to know, we get in the way of the patient's figuring out, which I think is a kind of a very nice way to think about that.
That really sets us apart from, I think psychoanalysis sets psychoanalysis apart from other disciplines too, this ability to work with not knowing and not teaching, um, in a certain way.
Yeah, sure. I mean, I'm mostly steeped in Jungian work, but I'm very also interested in other theories and the weaving of theories together, as you're suggesting. And I think, the negative capability, negative capacity of poetry really brings us into that symbolic of there's a part of the symbol that we're connected to, otherwise it wouldn't resonate, but it also leaves open the unknown. So the symbol is the perfect combination of the known and the unknown. So in Jung's work, it's about living the symbolic life, and that loops back to what you were saying about poetry. And as practitioners, if we're living in that way already, I sense that we create a kind of atmosphere that allows the patient to come in and feel that at some level. And then also know when to ground in concrete reality, again, depending on the patient's orientation, and move in and out of the symbolic and the concrete. I love that combination of the poet and the engineer. Isn't that like the perfect
Thank you.
combination?
I like that.
Yeah, thank you.
Thank you.
Does that make sense in terms of what you're
Totally makes sense.
great?
And I think a lot of, you know, what we are often trying to do is to live in a more, with patience, to be in a more symbolic place
More freedom, yeah.
and to kind of be able to do that. I'm not very familiar with Jung's work, so I can't say anything about that, but I like what you're saying.
Thank you. I like what you're saying.
Carl, do you want to unmute yourself?
Yes, thank you.
I can't hear you.
Carl, looks like you muted yourself by mistake again.
Okay, can you hear me now?
Yeah.
Yeah.
Okay, thank you. In fact, I might do better being muted. That's a possibility. Um, two quick thoughts about your presentation, which and your book is it's it's fascinating and so useful, which goes back to what you said earlier, which is, are we doing something useful? And it's so interesting when I think about making the conscious unconscious
Uh-huh.
and the virtues of subjectivity and reaching the capacity for play. Because so often the play aspect, a lot of our patients are playing dead,
Uh-huh.
and we don't go along with them enough.
Hmm.
We want to bring them alive before there's enough oxygen in ourselves, you see, to breathe. So I like the idea of fostering subjectivity
Mhm.
and being patient with that experience.
Yeah, I think that's a very kind of key thing that you're saying. Um, about, you know, I mean, I feel like one of the things is that we are always wrestling with a question of how valuable what we do is, the kind of self-doubt that we have to live with.
What your comment reminds me of Pessoa, the Portuguese poet's work, and he moves from, rather than object relations, he talks about subject relations.
Uh-huh.
Takes it out of the when he's speaking about there are multiple egos, there are multiple eyes. And so it becomes, rather than in Kleinian object relations, it's like, no, these are all subjects. And
Mhm.
so that immediately takes us into a different kind of dynamic. And he speaks a lot about the othering, and not just othering in the worldly sense, which is there's a lot going on, but intersubjectively, the othering that's happening. And if we come into a subject to subject relationship, maybe that's a model that as practitioners would be healthier for ourselves and our patients.
Uh-huh. Yeah, that sounds like a really interesting idea there.
Oh, Rich. Just thinking about Rich. I was just thinking about you.
You're thinking about Rich?
I think a lot of what people are talking about is the narrative, the deadness of narratives
Uh-huh.
and how to make them alive and how difficult that can be with some patients. And I think Carl was talking about that and a number of people.
Hmm.
And your example with the gun smoke is such a good one.
Uh-huh.
You stay with the patient and you found a narrative that you could join. And I thought in a very playful, skillful way, you made as Carl said, the conscious unconscious,
Right.
brought him into a more symbolic realm. I don't know
Yeah.
how long it took you to do that, and congratulations.
Well, a while, you know
I
that.
might have shot him, but anyway, you.
Yes, Lawrence.
I had one more thought. I think it's important for us to focus on Lacan's concept of the real and the notion of the impossible and the indigestible and what we may never know. and which emerges in states of anxiety. His whole seminar 10 is all about this. And how in so many ways, piggybacking on what Rich just said, we're caught up in our narratives, in the stories we tell ourselves, and in what Lacan calls the ego.
Right.
It's a lie, it's a fiction, it's the stories we tell ourselves and other people, and it's all the identifications we're still trapped in. And he ultimately gets to what he calls subjective destitution, which means having the courage, and this is a long, hard analysis, to relinquish our ties to these identifications, which in so many ways have substituted for who we are,
Mm.
rather than merely continuing to live out the desires of others.
How do you hear the real in what you just said?
The real emerges. It's like he will say anxiety is the only affect that does not lie. And and that is the real. That
Mm.
is the real which we want to categorize, we want to name it, we want to make it into a symbolic structure, and we try, and we do the best we can, but we never really get it. It's beyond. And that's part of the poem that each of us is.
Mm-hmm.
You know,
Thanks.
it's how I see it, you know.
Yeah.
Yeah. Brent and then Teresa.
Thanks. Want to thank you, Joseph, for a marvelous presentation, and the interviewing was also superb. Um, in order to say that, I should have a comment to add, which has to do with the engineer and the poet. I like that a lot. Some may know that I've written about comparative integrative psychoanalysis, which relates to the spokes on the wheel. And I would like to think of, as perhaps you do, Joseph, of integrating the poet and the engineer. And in that regard, I think of how when we write a poem, and Lacan saying that we're all poems and so forth, and the patient is a poem, that we work on poets work on their poems a lot. They rarely just publish what comes out of the pen, but Leonard Cohen being a famous example of someone who would work for years on each song or poem. And so there's a certain amount of engineering or architecture to a poem, and we constantly work on our poems or our songs to bringing in these architectural principles. And sometimes we work kind of solo, or we may work with someone else, a close intimate, an analyst, and we develop our poems. So maybe there is a way of both the engineer or the architect and the poet being essential aspects of the psychoanalytic process, the structural and the phenomenological. That's one of the things I would take away from your talk, and I would ponder how to integrate those two things that you've usefully isolated, but now to bring them back into a kind of a dual unity. Thank you so much.
Well, thank you. I think that's a really important thing you're saying about poets. Do not just like throw out poems. That's a lot of work put into a poem, until it's just right and it works.
Yeah.
And
Has to have a certain shape, a certain structure, if you will, or unstructuredness, but a structured unstructuredness. Yeah.
yeah, that's a good point. Thanks.
Thank you.
Teresa, and then I think Teresa.
Yeah, just briefly, I wanted to comment on the idea of the real being very bound up with trauma, and that the sense of anxiety, undefended by, if you want to think of it as structural, by the defenses and even the ego functions, that the real to me is very powerful. And Yeah, it's terrifying actually when I think about it. I was trying to teach it to my students once, and they were kind of laughing about it because they are clinical social work students, but they're saying the real had a different meaning to them than it
Absolutely.
did this way. Anyway, just a comment, that's all.
No, I think that's a good example of something, which is that we use the word like the real, and we think we're talking about like the table I'm looking at. And in fact, it has nothing to do with that. It's a much kind of more powerful idea. And that's kind of one of the things we struggle with all the time, is to how to find language that'll really kind of capture what we're saying. And
Requires the to resist Googling something, like just thinking of like a group of young people. They, when a question comes up, someone asks a question of someone else, there's always this urge to, I see them start to go to their phone and ask Google for answers about themselves that are just not, you can't really find on Google, or you can find one, but it's not real. It's not the real. It may be real in some way, but it is a constant, I think, necessity to resist that urge to, I guess, look for the truth, as Google might present it. Uh, Karen?
Yeah, I just want to make a last pitch here for Kristeva, who talked about the true real, right? And what she says, and she's talking about a patient, and what she says in the end is, do we want to analyze it away, or do we want to make a poem out of it? So I think that fits with
that's perfect.
what you're saying and what other people are saying here. Yeah.
Okay, just one last comment. I think she's stealing actually from Winnicott. That I think somewhere in Winnicott he says, do we want to get to the true self or not? This is a question. Do we really want to get there, or do we want to leave it a secret? What is citadel? He says something about a secret citadel of the self, And I think she's doing a riff on it. That's all. The professor in me has to do this. I'm sorry. I apologize.
They'd be on a spoke together, the wheel metaphor.
But isn't it the dynamic of process and structure? Again, going back to the poet and the engineer. It's the same with art. There's a process that the unconscious brings up images or movement, and then the conscious mind responds, and then you develop further. So it's again that back and forth between the known, the unknown, the conscious, the unconscious, the engineer, and the poet. And so it keeps it in movement rather than static entity, solidity, which I think is really important with our current obsession with identity. What if identity is fluid? What if it's a process rather than a thing?
So does anyone have a last comment or question before we end? All right, so Joe, I just want to thank you again for such a wonderful presentation, and thanks to all you participants for the lively discussion. I see the hands clapping.
Thank you very much.
Thank you, everyone.
Our pleasure. So I'd like to finally offer a special thanks to Leah Blady, who is our amazing executive assistant. Leah, you can wave your hands so everyone knows you. She's done a great job keeping us organized. We really could not run these things as smoothly as they've been going without her. So I wanted to say that. And I also just want to say I have unending appreciation for my fellow officers, Danielle, Rockefet, Megan, and Dustin, without whom many of the things that we create wouldn't happen. And I'm really proud to call you guys colleagues and friends. For those of you guys who want the CE credits, please make sure you fill out and send in the evaluation within 3 days of receiving it. You will get it by email if you have made the 90-minute requirement. And again, please check out our website for upcoming events. It's www.adelphiaspp.org. Our next event will be an in-person event in Garden City, and Dr. Kahoud Dustin will be presenting a recently published paper. So if anyone would like to join us for that, please check out the website. There's more information there, and we'd love to have you. So thank you for joining us. Enjoy your evening, and Dustin is going to end the meeting now.
Thank you so much, Joe. Really appreciate it.
Thank you, guys.